Okay, Ms. Crockett.
And Mr. Chair, before I begin, I do have two UCs that seemingly work really well right here. One says farm bankruptcies in 2025 already exceed 2024 levels. That is from Hoosier Ag. And the second one says farm bankruptcies rising in 2025. All right. The reason that I wanted to talk about farming is because it seems like we think that we can talk about things in some sort of vacuum. You can't talk about healthy children if you don't talk about whether or not they have money to access any food, whether it's good or bad. Some would argue that if you don't have money to access food at all, whether it's good or bad, it's probably bad for the child to not have anything in their body. The reason that those on my side of the aisle keep bringing up these cuts is because we know that we already have a hunger problem in this country. Considering the fact that we have a hunger problem in this country, it's now only been compounded by the poor policies of this administration and House Republicans as well as Senate Republicans. You see, I don't believe that you can just have a mantra where you say, make America healthy again, without actually doing the work, because as the good book says, faith without works is dead. So let's talk about the work that really needs to be done. Number one, it's in policy. Policy that doesn't look like ridiculous tariffs that unfortunately now have our farmers going under. In fact, to be very specific, farm bankruptcies are up 55% compared to 2023. Which minimizes the amount of food that we do have that will be available. And ultimately, that food will be more expensive because that's simple economics. Yet at the same time, the $6 a day that people get to eat, that's going away. And besides the SNAP benefits themselves, we're talking about those kids that only get their food at school. And we are able to set the guidelines for whether or not that's healthy food or not. The reality is that I am so disturbed because under this Department of Health and Human Services, literally, they have become the threat to the American people. Serving from the state of Texas, unfortunately, we had to endure the very beginning of the measles outbreak. For the first time in 20 years, children are dying. That doesn't look like making us healthier again. In fact, a lot of people want to talk about measles, but the plague is back now. We had our first contact of that recently came out. And we know how the secretary feels about polio. Polio may end up coming back. Right now, President Trump, Secretary Kennedy, and congressional Republicans are perpetuating the most significant public health attack on Americans ever. In just a few months, they have diminished HHS's ability to respond to outbreaks and emerging health threats. They've dismantled teams that ensure Americans are consuming safe foods. They've weaponized the federal government against universities performing world-class research. They've implemented the most significant cut to healthcare in American history. These people hate it when American families have access to healthcare. They hate it when American families have access to healthy foods. They hate it when American families have access to affordable housing. They hate it when American families have access to affordable childcare because these people simply hate America. Nearly everything they have done makes Americans less safe and less healthy. The consequences of their actions are simple. More children will die and have. More children will go hungry. More children will live in extreme poverty. More children living with disabilities will lose access to school-based therapies and services. So, Dr. Frink, you're here to rubber stamp this agenda, an agenda that's so unpopular the Republicans are deciding to cheat in next year's elections. But nevertheless, let's talk about it. Dr. Frink, in 2021, you provided a presentation at the University of North Texas Health Speakers Bureau titled Women's Health. Do you remember that, yes or no?
Yes, I do.
Well, during this presentation, you spoke at length about the importance of vaccines. In fact, one of your slides stated, quote, clusters of under or non-immunization have the potential to foster transmission of vaccine-preventable diseases, including measles. Is this a slide from your presentation, yes or no?
I haven't reviewed that presentation recently,
so we're going to go you don't know. You work under someone who has become the face of the anti-vax movement. So who's right, you or the secretary?
Thank you so much for that.
You or the secretary?
I would like to tell you that Secretary
You are the
Kennedy
secretary.
is challenging us to use gold standard.
So you're going to
science
filibuster,
together.
and I only have 25 seconds. So I'm going to go with you, assume you, but you know that he's your boss. This administration has lost all credibility with the American people and our global partners. No one believes you care about improving health outcomes when you're slashing NIH research into Alzheimer's disease, women's health, cancer, and diabetes. No one believes you care about public health when you cut programs that support maternal and child health and eliminate Healthy Start. No one believes you care about children when you implement the largest cut to Medicaid in history. Americans know the truth, and the truth is that this administration, with the help of congressional Republicans, has unleashed the most significant assault on public health in American history. The people will die as a result. I yield back the remainder of my time.